deliver a really important service to our community. The Women's and Children's Division looking after mums, babies, children and all the maternity services here, and really being able to deliver that service to families closer to home is a really key important part of our care.
And we didn't actually know that there was a paediatric emergency waiting area. So it was really nice to be able to go in there and wait rather than wait in the area with all the adults.
Women in our community don't have to travel too far. We have a large catchment area that we service, and those women can come into our service to birth rather than travelling into a metro.
Staying in the Northern after staying in one of Melbourne's renowned hospitals, I can honestly and wholeheartedly say that my experience here was absolutely astonishing.
Our team are really skilled, they're knowledgeable, and they want to provide high quality care to you. They want to make you feel safe, they want to make you feel special and supported.
We offer, a great array of services, and it means we've got access to things like medical obstetrics and ICU and neonatal services that small hospitals don't have. But we still are small enough that we know our patients intimately, and we really care about what's important to each individual family.
We provide culturally safe, holistic care for Aboriginal families coming into the hospital to birth. So we don't just look after their clinical needs, but we look after all their social needs.
Well, I think Northern Health goes above and beyond regardless of where you've come from, and we make sure that everyone, regardless of what language they speak, what culture they practice, that they're being catered for. And we have a large amount of interpreter services.
There are so many cultural differences for every family, but having our staff from the same cultures really helps us to understand what's important in those different families, and we can incorporate that into the care that we provide.
The care they show for kids is just phenomenal. We were seen quickly, we were well looked after, they had a plan in place straight away, they really knew what they were doing. So,
one of the things we developed based on patient feedback was around the usability of information and having it at hand when it's actually important. So we developed a smartphone application, and we were the first public hospital in Australia to use that. And that delivers information at a time that is most relevant, and it also gives women a platform to ask midwives a question when it comes up, not have to wait weeks for their appointments. And it means that women can actually chat to each other as well.
They just make you feel so safe. They'd set up the room with a rock salt lamp with the diffuser. I didn't have to ask. The lights were dimmed, there was music playing, and that was walking in.
Everyone here was exceptional. It was really quite a beautiful moment, one we're going to remember. Yeah.
I like staying at the hospital because there were pancakes.
There were pancakes. Good. Well done, Mum.